let's start with the pandemic because, you did become a really strong voice, not just in Michigan, but nationally against medical disinformation and about health measures to prevent the spread of COVID and about vaccines. And now we have probably the biggest anti-vaxxer in the country, who is the head of our Department of Health and Human Services, Robert F. Kennedy Jr. So what impact is this having on people's health?
Yeah, I mean, I think many of the actions this guy is taking and has taken, and just simply having the megaphone he has, I think, has had an impact in a few ways. I think starting with the most recent development of him basically canceling mRNA research, uh, incorrectly stating, and I think intentionally incorrectly stating that they're looking for safer avenues. I think they said that, well, Americans have lost faith in that, have lost faith in the institutions. And so, they have to kind of take a turn. But he is the purveyor of the misinformation and disinformation that has led to people losing faith, right? Or a
Right.
segment of the population losing faith.
It's
The
the ultimate
mRNA
bad faith argument.
it is, right? So they're the ones who are breaking it, and then they come and say, "Well, it's broken, so we gotta go back to something different." And the reality is, the mRNA, the platform, it's really just a technology that's been in development for a decade before COVID-19 was something that anyone ever uttered. And it's something that can create vaccines on a rapid scale like we saw in the pandemic and saved millions of lives without a
Right.
doubt.
Which, we should know, Operation Warp Speed did, that most of that took place under the first Trump administration and
Yeah.
arguably was like his greatest achievement. And now his health secretary is trying to undo that legacy and, anything beyond because I mean these vaccines are there is research and there was testing going on like for a vaccine for cancer, correct?
Yeah. Yeah, yeah. So, I mean, essentially, brain tumors, glioblastoma, one of the most deadly tumors you could be diagnosed with. Probably 95% of people are dead within 5 years, I think is the numbers. And
Right.
there were trials going on, have been trials going on, looking at hijacking the body's immune system using the mRNA technology to make antibodies directed against tumor cells. So currently you treat most cancers. There's a lot of treatments like this with using immunology, using targeted treatment. But what people think of with cancer is chemotherapy. You take a drug that kills cancer cells, but it also kills good cells, right? That's why people get so sick and they lose their
Right.
hair and their bone marrow dies and they get incredibly ill. And this is a technology that could allow people to actually treat their tumors, not die from these horrible diseases, and also not get so sick and have all these terrible side effects. And this guy just said, "Yeah, we're gonna throw that away," because he decided that people didn't trust it, right? But of course, we know
Right.
why they didn't trust it. I mean, you talked about Trump in Operation Warp Speed. I think it may have been his only achievement, at least in my opinion, certainly on the healthcare side, but maybe across the board that helped such a significant number of people. The fact that he did not run on that when he was running for reelection, the fact that he didn't run on that is mind-boggling. Any other president in history, Republican, Democrat, anyone, that would have been the on every bumper sticker, right? On every
Right.
sign at every rally, because it was, and we couldn't refute it, right? He didn't do it, but he was president when it happened. You get to take credit, right? Jobs will go
Right.
up, jobs go down, you get blamed, you get credit. This happened when he was there.
Right.
This should be coming out of his mouth every day, and instead he's empowered RFK Jr. to run that agency and basically run it into the ground.
Right. And at the same time, we've seen these massive cutbacks in research for all sorts of diseases, all sorts of medical research, grants that hospitals and universities, had been receiving, and they're now being cut off. And so it's like a full-on assault of our medical infrastructure, our research infrastructure. Why do you think the Trump administration is doing this?
Boy, it's really hard to say. Like, they talk about woke, right? They talk about these institutions. I guess somehow coming down. against what Trump stands for. The so-called woke agenda, I guess, is what they're railing against. It feels like they have a real problem with like truth, right? And
Right.
science. That's kind of the core of science. It was the core of the pandemic response. Not everything was done right throughout that process. It was like building the plane as you're flying it
Right.
when it came to trying to save lives. I know that. We know that. Maybe public health folks didn't communicate that as well as they could have. I would say that's the probably the only offense we can say, yeah, okay, myself included, we didn't lay it out as well. The things that we knew were going on that didn't get out there to the public as well as it could have. But the reality is that we were always seeking the correct answer in medicine, in science, hopefully in our lives. We're always seeking some degree of ultimate truth, whether it exists or not. And that
And to
feels
help
like,
people, to save
yeah,
lives, that's the
and that
ultimate goal.
feels an antiquated a calculus for this president, right? And this administration, seeking out truth and actually speaking truth just doesn't seem like a currency they deal in very often. So, sort of,
Right.
getting rid of research that probably for him doesn't keep him up at night. And so,
Yeah. But that's
yeah,
going to affect us all. I mean, whether
it
you
is.
voted for Trump or you voted for Harris or, you're rich or poor, obviously it will probably have more of an impact on you, the less access to healthcare that you have. But in general, I mean, what we saw with the pandemic, there were plenty of, prominent people who died of COVID, like Herman Cain, big Trump
Yeah,
supporter.
yeah,
I mean, disease can come for anyone, and so, this sort of haphazard approach to, well-established scientific research, it's going to affect us all, and the only explanation I can come up with is just that, authoritarians like to control the flow of information. They want to
right.
control people. And, even if this will cut against them or their family members in some ways, it seems like that's the greater goal because, telling people like, yeah, we want to stop research into a cancer vaccine. I mean, why would anyone think that's a good thing?
Right, right. Well, I mean, at one point, I remember he said he was against research on transgender mice, and that was a problem he had with the researchers. But it was actually transgenic mice, and it was basically using, genomes of one species and another. And you can have ethical issues with research on mice, and I think that's a valid thing to have. But again, it's just that complete lack of understanding, and then you combine that with this sense of ultimate power and the unitary executive that he has been handed, and that his supporters within the administration almost to a person now completely support. And you do get what you said, you control the flow of information and you try to cut off the most accurate information, whether it serves you, whether it serves your supporters, whether it serves the people you're supposedly representing or not. And it seems like going in the opposite direction. And this, I mean, this is what happens, right? Elections have these kinds of consequences. I know at the Committee of Protect Healthcare, we were talking about that, partly why we launched the Substack Paging America and the podcast that's going with it, because I think we have to have as many sort of voices and channels of information out there talking about sort of things based in truth, based in reality, highlighting the damage that this administration and this Congress and this health secretary the damage they're doing to those institutions, but really to the people in the end. We
Right.
don't know 20 years from now the diseases we won't be able to treat because of this, but we know they will be significant.
Right.
Um, the good thing about this, different than the Medicaid cuts are terrible and probably generational, right? When hospitals close, they don't just open back up in January of 2029. Hopefully, right? Hopefully we can keep this kind of in play and we can turn this back on at some point in the less than distant future. So that's, I guess, hopeful and also a reason for people to stay engaged and understand kind of who is in charge in the next 2 years and the next 4 years has a dramatic impact on so many parts of our life, but certainly on people's future health. That's
Right.
really critically important. So they got to keep that in mind when they're voting in the next couple years and 4 years.
Right. Well, the anti-vax movement was gaining in popularity long before COVID, I would say for at least a couple of decades. And, I've I've read countless articles. Usually it's about nice suburban moms who are
Mm.
just asking questions. Maybe they're concerned about their kids' health, concerned because their children are autistic and looking for, solutions or answers. Um, but I'm wondering if one of the reasons why you've decided to launch Paging America is because, the mainstream media it has not been doing its job in separating fact from fiction, conspiracy theories from fact. Do you think that they bear some responsibility for the point that we're at right now?
Yeah, I think it's frustrating. It's that old adage, if someone says it's raining and someone says it's not, the job is not to say it. Some people say one, send the other. Just open your head and put your head out the window and see if it's raining, right? And
Right,
so the data's all there. I mean, just volumes of research telling us that there is not a link between vaccines and autism.
right.
And it's really, it's not only is it misinformation and damaging to the movement to actually promote vaccines and to promote health, it's really I think, cruel to these parents, to these suburban
Yes.
moms, to these families, because they have a child. I mean, I have 3 kids. I love my kids more than anything in the world. You do anything for them, right? You take a bullet, you give your life for them, of course. And they have a kid who's afflicted with a disease, and even on mild forms of this, on the spectrum, present real challenges with severe autism, like massive challenges, to people in their lives, both the individual and the families, and you're giving them something, right? You're giving them
Mhm.
an answer because the reality is medical research hasn't given an absolute answer. It's probably many, many factors, some environmental, some genetic, some triggers, some we just don't know. I always tell
Sometimes,
people,
there's
yeah,
also the fact that, there's much more diagnosis now for autism than there
there
ever
is.
was. So it's
There
not like
is.
there's been this explosion necessarily. But the way
Yeah.
that like RFK Jr. talks about people
Mm.
who are autistic, I mean,
Uh,
clearly he sees them as being less than,
oh, yeah.
and he's exploiting people's fears and concerns, people who love their children, who love their family members, but clearly he doesn't share that opinion. He sees this as something that is a defect, which it
Right.
clearly is not. And that's damaging in and of itself, aside from the damage he has inflicted in terms of vaccines.
Absolutely, and let's be real, right? It all comes down to the grift and the profit, and he's made a lot of money off of that
Yes.
rhetoric. He's made a ton of money off of lawsuits against vaccine manufacturers. And so, like everyone else it seems in this administration, you don't have to look too far. You don't have to peel back the layers too much to see the ultimate motive at the bottom of all this. And the other thing for him and the thing for Trump, why Trump embraced this, it was a political calculation on Trump's part, right? He
Right.
got a person and a block of voters, and for that, he traded away the reins of HHS. I don't know if Trump has strong opinions about vaccines or research or any of it. I would argue probably doesn't spend a lot of time thinking about it. But he sure as hell wanted that group of people to vote for him, right?
Right.
In a very close election. And he got that. And so
Right.
he can just wash his hands and leave it all to Bobby and then here we are. This is the
And
state
then
we're in.
whenever he's asked about, say, "Oh, the vaccines are fine, whatever," and move
Right.
on, and somebody
Right.
asks him another ridiculous question, maybe about his ballroom. So,
Yeah. Right.
right. So
Right, right.
there's just very little accountability there, and clearly Kennedy has just enormous power and free reign to do what he wants.
Yeah.
Um, yeah, and you mentioned earlier about the Medicaid cuts, and so I definitely want us to talk about what's in Trump's budget bill that, was passed by the Republican Congress. There are just enormous cuts to Medicaid. There are even cuts to Medicare, the Affordable Care Act, which, also at the administrative level for, the Department of Health and Human Services, they've been going after Obamacare as well. So
Right.
it's this two-pronged assault. And, there are a lot of estimates as to how many people lose their health care, anywhere from like 12 to 22 million when all is said and done. Um, you know, which is just staggering to think about because, nobody thinks that the healthcare system was running particularly well to begin with before these cuts,
Right.
and so um, and the justification for these cuts was to give more tax cuts to rich people like Elon Musk. That was the main reason. So I know that these cuts are going to be phased in over time to some degree, coincidentally after the midterm elections for a lot of it, which is very cynical. But, can you talk to us about what our healthcare system is going to look like over the next few years and what this is really going to mean for people?
Yeah, I think particular people in rural communities, but really across systems, because now with consolidation of hospitals, you have massive entities kind of owning little bits and pieces of hospitals in urban places, suburban, rural. But as we take people off of the Medicaid rolls, and particularly attacking those people with expanded Medicaid in Michigan, they expanded Medicaid under the ACA. 1 million people in Michigan, where we both are, have Medicaid under that expansion. When you take that away, it hurts those people, right? And so most people, whether they have Medicaid or know somebody, a friend, a family member, it will impact them or people they love directly. But the other thing that happens is you have a group of people who no longer have health insurance, but they still have needs. They still have heart attacks and strokes and appendicitis and other medical needs.
And they'll
And
come see
thank
you in the ER.
well, they will, and thankfully, we have a law that says I have to see them, and I love the
Mhm.
fact that MTALA, a law that says we have to see them. They come in with emergency, with any complaint, they come in labor, you have to see them. The problem is if they don't have insurance, they can't pay for that care. So now you have hospitals taking on uncompensated care. They're not gonna just absorb it, right? So part of what they're gonna have to do is cut services because they can't keep everything open. So you are gonna lose labor and delivery units in many rural places that already are OBGYN deserts, that frankly, in many red states with strict abortion laws since the fall of Roe v.
Right.
Wade, already are deserts for OBGYN care because
Right.
people are terrified to practice in these places, right? Because if
Right.
they treat someone having a miscarriage or an ectopic pregnancy that isn't quite in line with some rogue prosecutor, they could find themselves going to jail
Right.
in so many places. That's going to get worse. And when those facilities, either an entire hospital or a clinic or a X-ray center or a labor and delivery unit go away, it isn't just the Medicaid folks who don't get those services. It's everybody. If
Right.
you have insurance from your workplace, if you have Medicare, if you buy insurance on the ACA exchange, those places go away for you too. And so
Right.
maybe out of selfishness, people will recognize this. People voted for this, right? They talked about this, that we knew these tax cuts were coming down. We know they increased defense spending while they did this, but the only pot of money they could find to offset some of these tax cuts for millionaires and billionaires was taking away healthcare from poor people and working people, and they did. And the impacts are going to be huge. I work in a small rural hospital. Uh, we're concerned about what's going to happen. You say it's till after the midterms, and that's true. But hospitals are already making decisions based
Right.
on this. Right,
Yeah.
a hospital in Curtis, Nebraska, announced that they would be closing in the next 12 months, I believe. They directly cited this bill, that they
Right.
know their revenue streams are going to go down so significantly, they can't continue to stay around and invest in those services because they're going to go away. The
Right.
money's going to go away. And so people will feel it, but it's also on us. I personally take responsibility to make sure people know about it. I think you guys are doing that just by having me on and other folks on to talk about it. And I think more folks need to talk about it and hold these politicians accountable come next November, because people have to know this is the person who voted to get rid of your hospital someday. That's
Right.
just, I mean, it's just plain and simple as I can make it.
It's incredible because, a lot of the most impacted areas are rural areas that, vote in higher numbers for Republicans for Trump. And that's where we're seeing hospital closures start. And I'm sure it's just the beginning of it. And,
Right,
they also have high rates of Medicaid as well. And
right.
so, if your hospital closes and if you're having a heart attack and you have to travel 50 miles to get to the nearest hospital, I mean, this isn't just an abstract, argument. People are going to die, right? I mean,
For sure.
we are going to see a drastic increase in people suffering and dying because of this,
And
which is
already
just
people delay
incredible.
care. They delay care
Right,
because of cost, right? I've seen this before the ACA, before expanded Medicaid. I remember a guy who waited 5 days coming in with chest pain until he couldn't breathe anymore. And he had a heart attack 5 days ago. And there's nothing we could do about the heart attack at that point. He was now in heart failure and had about half of his heart function. And if you came in that first hour or first 6 hours or, some shorter amount of time, we could have rescued a significant part of his heart and not left him in debilitating heart failure.
right,
That is going to play itself out, not just the long transport times, but frankly, the people who say, I just can't afford it. I can't go in there and wait until it's so dire that they have no choice. It's uh it's yeah, particularly cruel. And again, like you said, particularly because it is going to most immediately and in the soonest way affect a lot of people who voted for Donald Trump and a lot of people who voted for these members who voted to take this away from those people.
right. I know another issue that has not gotten as much attention as the budget, but the Health and Human Services Department has been looking to have more aggressive oversight of a federal drug discount program, 340B, which a lot of hospitals depend on, and they've actually been wanting it to be expanded in states like Michigan and other places. How does that fit in terms of the situation that a lot of hospitals are facing right now?
Yeah, I mean, that allows them to deliver, medications at a lower cost. And one of the biggest drivers of healthcare expenses is high drug costs. I mean, we at our organization have worked on prescription drug boards in a number of states, including working on getting something through in the state of Michigan, because that is the single biggest thing people are facing. A third of people report in multiple reports over the past several years skipping their meds or cutting their meds. I know that's a study out of Michigan, and so I think it's again particularly cruel. But then you combine that with the fact that Trump just announced massive tariffs on drug importation, in addition
Oh,
to tariffs
right.
on everything else. It's because he wants to have them onshore the production of medications. And so he thinks he can slap 150, 250% tariffs and immediately they'll just start making the drugs here in the States. Like that isn't how production works. The guy who's kind of obsessed with buildings and factories and all that, it feels like that's his desire to see all this stuff being made here. But it's just without an actual policy in place to actually do that. It's just penalizing and it'll drive up costs in that respect as well. And then again, yeah, the Medicaid cuts are going to just make more people have to pay more. And if they scale back to the 340B program, that is going to drive up those costs as well. So I think you're
Right.
hitting people on so many fronts. I mean, it's almost hard to keep track. You get whiplash kind of looking in every direction on how the ways that they're hurting people seemingly intentionally. It's kind of bizarre to think about it.
And even if, you don't have Medicaid, I mean, it seems to me that a lot of people are going to get sticker shock with their healthcare premiums next year just because you're putting so much strain on the healthcare system.
They've announced across the board around 20% is going to be the increase. That's the current estimate. The other thing that is set to happen is the premium tax credits are due to expire, the enhanced tax credits for the ACA. So that's about
That President Biden had signed, that makes, your premiums more affordable for a lot of people if you're on the Obamacare exchange.
Yeah, yeah. And so yeah, I mean, we're talking. The number I just saw from Kaiser Family Foundation was a 500% increase on folks making less than $25,000 a year of their premiums for healthcare.
And
So
so
they're
they'll
driving it
be
up.
and so, when you can't afford it, then,
You just don't do it.
right.
You just don't do it,
So
right? Because you can go in again with MTAL. You can go in if you get real sick. You can go to the hospital and someone's going to take care of you, and that's great. We should. But then you just have, and I mean, a judge in Texas just got rid of the Biden era initiative to not have medical debt on the credit reports, and all that medical debt is going to make it so people can't buy a house, can't buy a car. I mean, it just compounds, and with so many folks, one muffler or one roof going bad away from nearly financial ruin. I mean,
right.
how is a 500% increase in health insurance premiums? How is that going to play in people's lives? It's going to be devastating.
For the last couple of decades, we've been talking about how do we get more people to have health insurance? How can we make it more affordable? And there was a lot of debate about we need Medicare for all, and that was something that was really popular with candidates like Bernie Sanders. And now here we are, where we're going drastically in the other direction. How have we gotten to this point exactly?
I mean, I think, greed, the profit-driven motive of the healthcare system in this country is something you don't see anywhere else. Any other industrialized country in this world has some form of universal health care. I was able to go practice medicine for 6 months about a decade ago in New Zealand, and they have like a national health service type system, and
Mhm.
that's not something I think we could fly. It would be like a VA system for everyone, but it was another country out there in the world where people could come in and not have to think about, if I broke my ankle or if I'm having belly pain or chest pain, how am I going to pay for the care? How am I going to pay for that surgery? Um, it was part of the contract they had with each other in their society, right? And it's strange for me to think, having a career in medicine that's now over 25 years, it felt like going through that process, it was just table stakes that we all kind of wanted more people to be healthier, and we
Mhm.
wanted more people to be able to afford healthcare. And this administration, really the entire Republican Party, with the vote they took on their big bill, is pretty much said, no, that's not the case.
Mhm.
A huge segment, at least of the political class, doesn't agree with that. They'd rather give those tax cuts to the billionaires than give healthcare to, working and folks and poor folks.
Well, we were talking much earlier before we came on. So I think the event that you and I met at in 2018 was a Progressive Women's Alliance meeting that I was
Okay.
speaking at, and that was back when you were running for Congress in
Yeah.
Westport.
Yeah.
And so, as a Democrat, and so, do you think that you'll ever run for office again? No.
No, I tell you what, everything I've done sort of from that point on has been sort of very focused on sort of my reaction to this system that we have, the healthcare system, and those politicians who have abused the patients I've taken care of over the years so much. That run really was based on that in a heavily Republican district that really had very little chance of having real
But
success.
interestingly, the person that you ran against, Bill Huizenga, who's, still
Yeah.
the congressman, his district is quite different, and he is vulnerable this time, so maybe you did help soften him up a little bit.
Maybe a little bit, but really that was about healthcare as well, right? That was
Yeah.
when they were coming after the ACA, and I saw this guy basically saying, the line that really got me going was, we need people to have skin in the game. And my response to that was, this is literal flesh and blood, right? You're talking skin in the game. This is actual skin. People are sacrificing their lives because of your guys' desire to just help rich people and take healthcare away from everybody else. So yeah, that was a lifetime ago. I think this project definitely a lot bigger scale, and hopefully can enhance the ability at least to keep people in the know of what's really going on out there, and hopefully we can change the trajectory over the next 2 to 4 years of where healthcare is going in this country by changing, who's actually in charge of making those decisions.
Yeah, well, I would imagine that just like in 2018, healthcare will be a huge issue in the 2026 election, and I'm happy to have you here in the independent journalism space, where we do deal in facts,
Right.
not necessarily in just presenting both sides, even if one side is conspiracy theory and the other is a fact.
Right.
And so I'm looking forward to talking with you more as we get closer to the 2026 election about really what the stakes are for healthcare and what we can do.
Absolutely, absolutely, and I'll be watching what you guys are up to as well, and hopefully folks watching this will come on over to, Paging America Substack, and, we'll try to do our best to keep it, on the level of real information, sort of trying to help fight back against the actual disinformation and help move us all forward in the right direction.
Great. And where else can people find the Committee to Protect Healthcare on social media and other platforms?
Yeah, committee to protect.org is a website, particularly, physicians, other healthcare workers out there who want to get involved. We'd love you to join up. We got lots of things going on, lots of actions that people can take. Yeah, and then the Paging America Substack, kind of our newest venture as a project of that, and Paging America, the podcast out there on all the platforms people can find podcasts. Would love them to come take a listen and hopefully join up and join the movement.
Great. Thank you so much for being here, doctor. And thank you
Thank
to
you.
all of you for joining us as well.